In the Philippines, people aged 60 years old and over are regarded as senior citizens. They made up 8.5% or 9.22 million of the household population in 2020, higher than the 7.5% or 7.53 million recorded in 2015. There were more females, 55.5%, than males, 44.5% among the senior citizens in 2020.
The statistics of the aging population are country.
Elderly who do not have a pension. According to the Commission on Population and Development or POPCOM, 4 out of 5 Filipino seniors do not have pensions and would have to rely on the government for assistance. There will be 5.53 million senior women and 4.53 million senior men in 2021, which means 4 out of 5 seniors do not have pensions. In addition, 1 in every 4 pensioners receive a monthly pension of below 2,000, while 3 in every pensioners receive below 5,000. Only 4% of pensioners receive 30,000 and above. COVID vaccine. The elderly are at the highest risk of the most severe outcomes of COVID-19. 7 out of 10 COVID-19 deaths in the Philippines are from this group. According to WHO, around 2.4 million senior citizens have yet to receive even a single dose of the COVID-19 vaccine. As of March 30, 2022, provinces with the highest number of unvaccinated A2 or senior citizens include Cebu, Negros Occidental, Batangas, Cavite, Bulacan, Negros Oriental, Nueva Ecija, Iloilo, Leyte, and Laguna.
Elderly living alone. Based on the 2015 census of population data, out of the total number of older persons aged 65 years and above, there were about 9.3% or 444,392 older Filipinos aged 65 years and above living alone. More than half of them residing in Luzon, with the largest population, 51,324 in Calabarzon region. Region 6 and Region 7 also have significant numbers of seniors of the same age range, with 47,707 and 45,201 respectively. Health. Persons 6 years old and above are considered vulnerable population and who are suffering from illnesses known as comorbidities. Those illnesses considered comorbidities are the following: immunocompromised diseases like cancer and HIV patients, diabetics, chronic cardiovascular ailments, and lastly, chronic respiratory. Based on the Philippine National Health Accounts Framework, health expenditures in 2018 for individuals aged 60 and above accounted for 22% of the total current health expenditures, while health expenditures for persons aged 65 and above accounted for 13.4% of the total health spending on the same period.
What are the implications for its country? Is it true to all countries?
The implications for the Philippines are as follows. Poverty and health. Respect for the elderly has always been the mark of Asian societies like ours. We put a high premium on preserving the dignity of our older people and put them in an exalted place in society. As such, there is a significant decrease in nursing homes or homes for the elderly in the country as compared to Western countries that prefer to reside in their old age citizens. Thus, there is a lesser demand for geriatric nurses and nursing homes in the Philippines. Due to the lack of facilities, elderly individuals who wish to seek assistance are deprived of such services. This scenario is anti-poor because rich individuals can use their wealth to simply hire private nurses, whereas poor residents who do not have enough resources and support systems have to rely on their own, especially those who do not have a government pension, social services, or savings. As such, as their health declines, so does their income and ability to surpass poverty since they do not have enough income to meet their personal needs. Economics. With an increasing number of aged people, the elderly pose a significant economic impact as their productivity declines. Since the retirement age in the country is 60 to 65 years old, those who are not able to save up before the retirement age significantly reduce their ability to surpass poverty levels. Their purchasing power declines, reducing their ability to procure basic necessities. As such, this directly impacts the entire Filipino population because the government had to inject more money into programs that would lift them from their socioeconomic status. Travel and leisure. According to data, elderly Filipinos are fond of utilizing their savings through leisure such as but not limited to travel. Travel expenditure directly benefits the economy by raising revenues, helps micro and macro business establishments in the travel destination, and promotes tourism.
Disease vulnerability. As the number of elderly increases in the country, so does the number of vulnerable individuals susceptible to emerging diseases such as, but not limited to, COVID-19. This puts a heavier burden on a health system that is already weak and fragile. Culture. Passing of culture can be viewed as an advantage for a growing elderly population. The more elderly population the country has, the more individuals who can share their culture with the younger generation, hence retaining some of the country's deep-held values. Living alone. Due to the lack of nursing care facilities and the growing number of elderly who opted to live alone, this can be a source of hazards, especially during calamities. The country is undeniably on the path of some of the strongest typhoons, earthquakes, and landslides, which is why elderly individuals living alone may be at higher vulnerability risk. Is it true to all countries? Partly yes and no. The country has implications that are very much similar and is experienced by most countries around the globe, such as passing down of culture. However, although they are similar, there are some aspects that are entirely different and unique only to the country because of factors and circumstances, as well as the environment vary in different countries. Causes of aging in the Philippines.
The understanding of Filipinos about the aging process is based on their contact with older Filipinos in their community and family. They mostly perceive aging as a positive form. Filipinos see aging not as the declination of the body, but as a period of favorable experiences and productivity increases. These are some known causes of aging in the Philippines.
The Philippines' geographical location. The Philippines have a tropical maritime climate, which explains the hot and humid weather in the country. Also, its location near the equator makes the country have near constant exposure to UV. Overexposure to the sun may weaken the skin's elasticity, causing a person to have wrinkling of the skin, which makes a person look older. Additionally, some Filipinos are ignorant of the negative consequences of excessive sun exposure, as well as the use of sunscreens and their function in preventing these harmful effects.
Poverty. The Philippines has a high poverty rate due to low worker education, a lack of specialized employment, living in rural areas, and the heavy reliance burden that the working age people must bear. In the Philippines, where there are a lot of children and young adults, there is a high dependence ratio, which prevents older Filipinos from saving for retirement because they have young dependents. Another major issue is that almost a quarter of Filipinos living in poverty are older adults who do not have the financial means necessary to sustain an adequate quality of life. In addition, Filipinos who are less wealthy often show the physical effects of aging more quickly. They range from poor lung function, earlier blindness, slow movements, also affects the physical appearance that despite being young, you appear to be older.
Poor nutrition. Aging does not only manifest in physical appearance. According to some studies, The poor diet of Filipinos affects their bodily function, which causes them to have a decreased productivity level. Proof of this is according to a registered nutritionist, dietitian, and former Food Research Institute specialist, Feli Valandria, that half of the Filipinos ages 19 to 60 years are not getting enough protein, while more than 90% don't get enough calcium, which leads to the bone, joint, and muscle weakness of deterioration.